Good afternoon, everybody. I'm Samyuktha from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, renal calculi. So, renal calculi, or what we commonly call as kidney stones, are hard, pebble-like pieces of material that form in one or both of your kidneys when high levels of certain minerals are in your urine. So kidney stones vary in size and shape, and they may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as urologist, can actually treat any pain and prevent further problems, such as a urinary tract infection, UTI. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. K. Samyuktha, MS MCH Urology. She has a rich experience and hands on expertise in urology, BPH, and stone management. She is currently practicing at Samyuktha Urology and Urogynaecology Clinic, Hyderabad, and also at Srikara Hospital. Dr. K. Samyuktha has rich experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. K. Samyuktha.
Hi.
So, doctor, today we are going to talk about kidney stones, and it becomes even more important to talk on the topic because it's quite common, right? So,
Yes.
first of all, we would like to understand what are these kidney stones?
So basically, kidney stones are nothing but there are minerals deposited in our kidneys, which eventually get crystallized and form stones. These stones generally form in the kidneys and they can travel and get stuck in the ureter. They can travel to the bladder. They can travel to the out urethra, or sometimes, rarely, they do form in the ureters or the bladder too.
Okay. And doctors, because we are continuously saying that it is quite common, so it's important to have the awareness, have the knowledge, have the information regarding kidney stones. Now, what are the main symptoms, the major symptoms by which a person can realize that it may be a kidney stone? Let's not take it that lightly and go and consult a urologist.
Yeah.
What are the major symptoms?
So generally, when the stones are in the kidney, irrespective of the size, generally the most common symptom would be a flank pain. So flank pain is nothing but it's a pain in the lower back just above our buttock. And sometimes when the stone, this is a very typical colicky type of pain. So this is not there continuously. It's a pain that is there for a moment. It peaks, it becomes very severe and then gradually decreases and it again comes back. This is called a renal colic or colicky type of pain. Generally, in kidney stones, this kind of pain is seen. Sometimes this pain travels from your flank back. Patients complain to us that we have a pain from the back, lower back, which is traveling onto the front in the upper lower part of the abdomen. So this kind of pain too presents. Generally, this kind of pain is seen when the stone is present in the ureter. So ureter is a pipe that connects the kidney to the bladder. Sometimes, rarely, sometimes male patients generally, they complain of severe pain while passing urine, pain in their testicles or the lower part of the thigh. Apart from pain, patients do complain also about fever, burning sensation in the urine, vomiting because of the severe pain, lower abdominal pain. These are the other most common symptoms which are also seen with the kidney stones. Apart from that, sometimes when the stones are stuck or when the stones are big, sometimes in severe conditions, they can also see blood in the urine.
Okay, so these are the major symptoms. Now, doctor, can it also be symptomatic? For example, I'm not having any symptom, no pain, nothing. But when I go for a scan or something, I find out that there is a stone. Is it possible?
Yes, this is a very common thing. So generally, most of them get a master checkup done yearly. So sometimes what happens, they do not have any symptoms. They are absolutely fine. They're asymptomatic. They are leading a normal life. And this just undergo a master checkup and the ultrasound report shows that they have 3 stones or 4 stones in the kidney. So this is quite a common thing. Not every time that stones do present with symptoms. There are a lot of times, about 30 to 40% of the time, where patients do not have any symptoms yet have small stones in the kidneys.
Right. And do these kidney stones form in just one, or it can form in both the kidneys?
Yeah, the chances of them forming in both kidneys are also high. Generally, one side is very commonly seen, but if the water intake is not very good, and if their adequate hydration is not present, and if it's present for a very long time, sometimes because of genetic reasons also, stones in multiple numbers or single numbers can form in both kidneys.
Right. Doctor, we are today talking about kidney stones, renal calculi, but we would also like to understand, because we get to hear that, somebody is having a stone in the bladder or in the urinary tract, etc. So, what all organs are there where stones can be formed?
So basically, stones can form in multiple organs of the body. When first we talk about the urinary tract, so the urinary tract consists of a pair of bean-shaped kidneys. The pipe which connects the kidneys to the central bladder, that those are called the ureters. Then there's a urinary bladder. Then there's an out pipe which is called the urethra. Surrounding the urethra is the prostate, which is mainly seen in males. It is not seen in females. So in urinary tract, which I've explained now, stones can form in the kidneys. Generally, most commonly, they are formed in the kidneys, which travel through the ureters and are also seen in the bladder. But very rarely, they can too form in the ureters and the bladder. The stones generally do not form in the urethra. These stones which are detected in the urethra have elsewhere been formed and through multiple reasons have traveled through the urethra. Sometimes prostatic calcifications are also seen, that is small calcifications noted in the prostate. Apart from the urinary tract, stones are generally seen in the gallbladder. The most common thing people also discuss about apart from urinary tract is the gallstones. Apart from that, these gallstones also similarly, there's a pipe which connects the gallstones with our intestine, the CBD. The stones can form there or can travel through the gallbladder and get stuck there. Stones can form in the pancreas. Pancreatic calcifications are also quite common.
Fair enough. And doctor, what can cause kidney stones? What are the major reasons responsible for kidney stone formations?
Yeah. So in our country, where we live in a very tropical climate, where the temperatures are generally very high, so here the most common cause of formation of kidney stones is not taking adequate amount of water or not being adequately hydrated. So not taking adequate amount of water, excess of animal protein, intake of excess of non-vegetarian food, mainly the red meat and all, or excess of intake of salt content. Apart from that, not regularly using washroom. So this is most commonly seen in the working class, where they try to hold urine for hours together. This can also lead to recurrent urinary tract infections and stones, because urinary tract infections and stones are quite an interlinked problem. So one problem neglected can lead to another problem. So the most common causes of stone formation are these. Apart from these, there are other conditions like excess of eating of oxalate-rich food like spinach or chocolates or cocoa food or nuts. These then also can cause stone formation. There are other different kind of stones too, like uric acid stones and cystine stones, which are not very common, but they are formed in presence of excess of uric acid levels in the body.
Okay, doctor, you have very well explained what all can cause kidney stones. Now, the very first thing or the culprit that you mentioned is inadequate intake of fluid or water, or when we don't keep ourselves adequately hydrated. Now, I'm glad you used the word adequate, because in our society, we have this tendency of hearing and saying as well that one should, drink a lot of water. There is a section who drinks a lot of water. There is a section who doesn't drink. You need to actually push them to drink even a glass of water or other forms of fluids. Now, my question to you is, doctor, because there are so many myths regarding water in our society, there is a section of people who will wake up and have, 2 liters of water at one go, or who will go to sleep and just before going to sleep, they'll have like 1 liter or one glass full of water. There are so many myths or so many things associated with water intake. I would like you to, define or elaborate as the definition of adequate water.
Yes. So the minimum amount of water intake per day for a normal human being is somewhere between 1.5 to 2 liters. A lot of people say, I am drinking a lot of water. Doctor, we are drinking 6 liters of water, 5 liters of water. But even that 1.5 to 2 liters of water needs to be taken in a correct way. So there are a lot of patients who come back and say that we have had 1 liter in the morning and about a half a liter or something in the night. There is no intake of fluids anywhere in the midway between that morning 8 and evening 8, that 12-hour gap. That also is not good. That also leads to one kind of dehydration of the body. So I would suggest that if you can get up in the morning and have a liter of water, that is very good, excellent. And apart from that, every 4 hours or something, if you can keep on hydrating your body with about 500 ml of water, or if you can have every 4 hours of 500 ml of water, maybe morning, then afternoon, then late afternoon, then evening, and then night, that would actually keep your body continuously hydrated, and that will almost about 60% of your problems of the urinary tract will be solved by taking water. Apart from water, you can also have a lot of coconut water, you can have a lot of buttermilk, you can have a lot of barley water. There are various ways, you can have a lot of fruit juices, but there are various ways to keep ourselves hydrated. But the minimum amount of water that anyone should at any point have is at least 2 liters of water per day.
Right. And as you know, excess or, deficiency of anything can be really bad. So please don't go overboard. Don't stay dehydrated. Just, have adequate intake of water or fluids and keep yourself adequately hydrated. That's really important. So the right way, as the doctor has just explained, is really important to notice. Now, doctor, we have also seen that many people, as you were also saying, that there are some food items like spinach, chocolate, etc., which can, cause kidney stone formation. Now, but there are a section of people again who will make a blanket list, even if they have never had stone, or it's not that the analysis after their surgery, etc., told them, or the doctor have told them not to have spinach, etc. There is a section who won't have these food items just because they know that they may cause kidney stone. I'm
Yes.
sure you also get patients who have the
Yes,
same
yes, a
query.
lot of them.
We would like you to elaborate or shed some more light over it,
Yeah,
the
so
food item
talking
connection.
about this oxalate rich food, this does not apply to everybody. So generally we ask a person who recurrently keeps forming stones, that is recurrent stone formers, is generally a person who forms stone has to definitely be careful with their diet, but their chances of formation of stone, if they are not careful with their diet, is almost 50%. So if a person has formed 2 or 3 or 4 times, they're recurrently forming stones, these are the patients where we would avoid them or ask them to avoid having, not completely avoid, but reduce the amount of oxalate rich food. So what are these oxalate rich food? All your nuts, your rhubarbs, your spinach, your chocolates, cocoa, beetroots, all of these come under high oxalate food. But for a normal, healthy, asymptomatic, no kidney stones, you need not stop having tomato or spinach just because they're oxalate food. Normally, for a normal healthy person to have exclusive oxalate stones, every day they have to eat a kg of tomato curry and a kg of spinach curry, which none of us generally do. Either we eat once a week, or probably we add it in dal, or we have a tomato curry, which generally we don't use more than 500 grams. So that is definitely not going to cause an oxalate stone. So I would plead or urge all the viewers who are seeing this, that just because we've said that avoid oxalate rich food, it doesn't apply to all of them. It generally, we suggest this to only recurrent stone formers, but not to the rest of the general population.
Right. So the bottom line is, please go consult a doctor and trust and follow your doctor. Don't do things by yourself. So consult a doctor, trust the doctor, and follow the doctor is really important. Now, doctor, as we are, continuously saying that it's important to know what are the symptoms so that you can be aware. And then in case you have these symptoms, please go and visit a urologist. Now, there are patients, because of course the diagnosis, etc., will be done from a doctor's side. So we can't just by the pain or etc. can say, confidently that, yeah, we have a stone and this is the size and this is the placement. Only a doctor after the test, etc. can tell us that. Now, many times, maybe a person had gone to you, get the diagnosis done. Now the person knows that he or she has kidney stone, etc. But then they won't follow up with the doctor. They'll go for alternatives. They'll because there are again so many myths surrounded in the society. They'll consume some alcohol because one of the theories says that it will actually make the kidney
True.
stone flush out. Then they'll go for alternative medicines. Only when the situation goes out of the control, the size of the stone increases, etc., that's when they'll come back to the doctor and get the whatever the treatment possible. Now, we would like you to tell us how important it is to go to a urologist at the first place after having these symptoms, and B, following up with the doctor. How important it is.
Yes. So one thing I want people to understand is a lot of people get confused between kidney stones and gallstones. And they think just because we have been trying to reduce the size or melt the gallstones, the same thing is applicable to kidney stones too. So the first thing I would like to say is gallstones and kidney stones are two different kind of stones. Gallstones are cholesterol-based stones and kidney stones are hard rock calcium stones. So these stones do not melt over a period of time. So if somebody tells you these stones melt over a period of time, no, these stones do not melt over a period of time. Either they have to be removed surgically or through hydration and medical management, they spontaneously pass off by themselves. So this is the first myth that I would like to tell all our viewers. The next thing that I would like to say is when you get a general ultrasound done or a test, please don't panic just because of seeing a kidney stone and try to run for alternative therapies. Okay, so the size of just because you see a 3 mm stone or 4 mm stone, you need not be worried. So somebody tells you that you have a stone and it needs to be surgically managed, about 80% of the stones in the urinary tract need not require surgical management. They're all treated medically. They need adequate hydration. They need a couple of alkalizers. Maybe if the stone is small and stuck in the ureter, you have peristaltic medications and all. But about 70 to 80% of the stones do not require surgical management. They can be treated conservatively or through medical management. So if you detect a stone or if you detect through an incidental ultrasound or a regular checkup, please do go visit your nearest urologist or consult your doctor, and they will guide you as to what is the next plan of care that is required for you all.
Right. And now we would like to talk about the treatment options available. How do you treat kidney stones? What are the various options available?
Talking about kidney stones or stones in general of the urinary tract. So the first, if somebody says that they have come with pain, as I've described, pain or burning sensation in the urine or pain while passing urine, fever, vomitings, or any of these symptoms, please do not neglect these symptoms and take over-the-counter drugs. Please do visit your consultant urologist and get it treated. So that there are two basic tests that need to be done. So these are not quite expensive tests. One is a complete urine examination and an ultrasound. So these will basically tell you a good idea about if there is any persisting infection, if there is any swelling in the kidney or any stone needed. So once the ultrasound is not very clear or just tells you that there is swelling in the kidney and not being, the stone cannot be identified or something of that sort, then we go in for the next line of investigation, which is a CT scan. So CT scan and CT KUB or CT abdomen and pelvis will tell you about both the kidneys, how healthy are the kidneys, is there any infection associated with the kidneys or the urinary tract, if there are stones, how many stones are there, what are the size of the stones, where is the exact location of the stone, is the stone very big or very small, is there associated infection with the stone, all these are known by a CT scan. So once a diagnosis of a kidney stone or a stone in the urinary tract is made, there are different treatment options. Most of the patients that come to visit us have either asymptomatic incidentally detected or they do come as symptomatic patients too. Most of them have stones which are generally less than 1 centimeter. So one thing that I would like to tell all the viewers is, do not worry when you see stones in the kidney. Please don't get worried and scared. or be anxious about it. Stones which are generally less than 7 mm do pass off spontaneously. The probability of stones which are less than 5 mm passing off by themselves is almost about 90 to 95%. If you adequately hydrate yourself, use a couple of alkalizers or something like that, these stones generally tend to fall off by themselves. About the stones between 5 to 7 mm in size can also pass off with the use of medical management. So there are certain medications, like there are certain syrups that help you pass off the urine, diuretics. Then you have certain medications, tablets, which help in passing off of these stones. The issue comes after the size of 7 or 8 mm. Generally, after 7 or 8 mm, the chances of passage of these stones all by themselves, the probability falls to about less than 10%. So then, based on the location of the stones, the symptoms of the patient, the size, the position, there are different treatment options available. So if the stone is in the kidney, and if it is recurrently causing infections, if it's recurrently causing pain, we have two options. One is the PCNL. PCNL is a technique where we make a puncture through the kidney, through the skin. We access the kidney percutaneously, and then we identify the stone and remove it. But now the latest technology, where what everybody is hearing about, the laser technology, is the RARS. So this is nothing but you send a specialized camera or scope, which is as thin as a wire, through your normal urinary tract, identify where the stone is, dust it completely with the help of laser, and then remove it. You have suction methods to remove it too. So this is the latest technique. The only advantage with RARS is the recovery rates are faster. There is no cut, there is no hole, no bleeding, no pain. So this is when compared to stones in the kidney. For stones in the ureter, you have a technique like URSL, where you have a same special scope, where you pass it into the ureter and you remove the stone either via laser or any other method. Then stones in the bladder also similarly can be done endoscopically to be removed.
Right. So these are the various options that we have. And I'm so glad to hear that, because normally a person with kidney stone or a stone in general in the urinary tract will panic, and they feel that, all kidney stones or all stones need surgeries. So, but as you have told us, there are so many advanced techniques, there are medications, etc. So initially it's the medication, it's by the, changing your lifestyle, or, making you adequately hydrated, etc. Such measures are taken in consideration. And only when the size is such, or there are other complications, that a person goes for other various procedures, etc., which are available. Now, the thing is, doctor, because as you said, stones are made up of various things. It could be, calcium, it could be something else. Now, the thing is there a protocol that after taking out the, stone through whatever procedure, you send it for some examination to find out what was it made of, etc., or do you do that as a practice?
Generally, for a first time stone former, we generally don't do it. But if the patient is recurrently forming, maybe a second time or third time, we do send it for stone analysis, because we definitely want to know what kind of stone it is. Is it a calcium oxalate stone, or a calcium phosphate stone, or a cysteine stone, or a uric acid stone? Because once you know the type of stone, the treatment would be definitely specified towards the stone, and the treatment options would be more better.
Right. And we have also seen that the recurrence of stone formation is quite common. So once a person had a stone, he has the chance of getting it again and again. So why it's so, doctor?
Yeah, so recurrent stone formations are also common in India. One thing is the most common thing that I get to see is after the stone is removed, the patient is quite careful for 1 year. After the 1 year period is done, he becomes lax, he becomes very, he takes it very easy, and then the same thing keeps on repeating. So what is either their water intake is not proper, or even if they take water, the intervals is very common, or they tend to neglect their urinary tract infections. So we tell a lot. The other thing that I would like to say is, whenever a person gets a stone, the first thing that they do is they completely stop having calcium food. So they think just because it's a calcium stone, we will stop. But this is an absolute myth. That is one thing I would like to say. Just because you have a kidney stone, if you stop having calcium in your food completely, the chances of you forming stone the next time will be very high, because that calcium does protect you from certain kind of stones. And if you have to reduce the amount of calcium that is being taken in the food, but if you completely stop having calcium in the food, the chances of oxalate rich other stones would be very high.
That's a very important information. I'll also take some of the questions that our viewers are asking. So Vandana is here, and her question is, I have been experiencing severe pain in my lower back and abdomen. I'm concerned that it might be a kidney stone. Can you please tell me more about kidney stones and how they are diagnosed and treated?
Yeah. So hi Vandana. So coming to it, yeah, your low backache can be because of kidney stones, or it can be a general low backache. So we would suggest you to just get a complete urine examination and an ultrasound done, just to get a basic idea as to really do you have kidney stones or is there any swelling associated with it. These two basic tests are right now sufficient, and if there is something that comes out of an ultrasound, or if it is insufficient or not yet, then we go ahead with the CT scan.
Okay. And we have Akanksha Puri with us. Her sister is suffering from kidney stone, and Akanksha's question is, how long does it typically take to recover from kidney stone?
Generally, if the stones are small, and if you are planning a medical management, or if you're trying to manage it conservatively through taking a lot of fluids, reducing the salt content in the food, reducing the protein content in the food, just reducing the amount of calcium, adequate hydration, good healthy food, generally patients do recover within a month or a maximum of 3 to 4 months.
Okay. Ankita Mehra is here, though we have already discussed it, but maybe because, so many viewers are asking the same question. Will I require any surgical procedure to remove kidney stone?
No, not every time. As I said earlier, about 70% of the kidney stones do not require surgical management. Again, it again depends on what symptoms you have. Then based on your ultrasound or a CT, where is the location of the stone, what is the size of the stone, any swelling of the kidney or hydronephrosis associated with. So there are other factors taken into account before deciding on the surgical management of kidney stones.
Fair enough. We have Dolly Saxena. Her question is, are there any dietary restrictions which I should do to prevent the kidney stone formation?
So there is not much of dietary restriction that is required. The first and important thing that more everybody should follow is adequate hydration. That is, if you can have regular intervals of fluid of about 2 liters per day, that is going to solve about 60% of the problems. Fluids or coconut water or buttermilk or fruit juices, you can eat all the fresh fruits and vegetables. There is honestly no restriction that you should not eat this kind of fruit or you should not have that vegetable. All healthy, all fresh fruits and vegetables are all healthy. So there is no real restriction. This is only for recurrent stone formers. I again urge on that, or I insist on it, that this is only for recurrent stone formers, that we ask them to reduce the amount of oxalate containing foods in their regular diet. But rest of the food, everybody can normally have it.
Right. Now, as we were talking about how important it is to understand that, what are the symptoms, and when you have the symptoms, you need to go and consult a doctor. Now, doctor, we would also like to understand, because kidney stone formation is so common in our society. Now, for example, if a person is having these symptoms, because again in our society we have home remedies, we have so many influencers these days on social media who have remedy quick fixes, etc., for almost everything. Then we have quackery is also increasing rapidly. Now, what a person should do if he or she is having these or any of these symptoms?
So as I've mentioned before, if they have any of the symptoms, or even if they're detected incidentally, please do not resort to alternative medicine. Kidney stones can be easily medically managed or managed conservatively. So please do visit your urologist or the nearest consultant urologist, get awareness from them, and then get it treated.
Right. And doctor, if a person is continuously ignoring or not going or not consulting with a doctor despite knowing that he or she is suffering from a stone, what are the potential complications?
Yeah, so the person or the patient knows that they have kidney stones. Either they have neglected it and all. Yeah, kidney stones can become a grave consequences. So these stones definitely can increase in size. They can cause recurrent urinary tract infections. They can lower our immunity system. Apart from that, these stones can result in severe infections of the entire urinary tract. In severe cases, stones left for a very long time in the kidney can cause the kidney to not function, resulting in non-functioning kidneys. We have done a lot of cases where these stones have been neglected for quite a number of years and have landed up in removal of the kidneys. So renal failures, kidneys not functioning can happen if stones are neglected.
Okay. And doctor, as we were discussing that, adequate hydration or adequate fluid intake is very important. 1.5 or 2 liter is a general, thing. Now, the thing is, I'm sure it varies from person to person because a person may sweat a lot, the other person is not sweating. A person maybe he or she is working on the field, and the other person is his or her working condition is, mostly remoted under AC cabins, etc. So of course it impact the sweating or non-sweating. Now, how to access? Is there any other way to find out that am I adequately hydrated or not?
So yeah, there are different methods to identify whether you're hydrated or not. First thing is the elasticity of your skin. Whenever you're hydrated, your skin doesn't look very fragile and dry. Okay, it looks quite healthy and supple. That is a one basic thing that you can identify. And once you are adequately hydrated, you don't have the dryness of the mouth, that thirst, that urge that is not there. And the color of your urine also can tell you your hydration status. Generally, the urine color is either pale yellow or white in color. When you're not adequately hydrated, you're dehydrated, the urine color and the concentration changes. It becomes far more acidic. It becomes extremely dark yellow in color. Sometimes it can also become brown in color. So these are some of the basic things where we can identify the hydration levels of our body.
Okay. And as we were discussing, doctor, before that, it could be symptomatic as well. Maybe person is not having any symptoms, but while undergoing any scans or, annual checkup, etc., they'll come to know that the person is having a stone. Now, because regular medical checkups are not that common in our society again, and maybe a person is having a stone for a long, long time, but he has not gone through a, scan, etc. Could it be dangerous or it's okay because it's asymptomatic?
So generally, yes, that again is quite a controversial question. So what we would suggest is if anybody, healthy asymptomatic person, also can undergo an annual ultrasound checkup, irrespective of whether it's a part of their master health checkups or not. That would keep a count on how the kidneys are, and we keep a count on whether we are neglecting or not. There are a lot of times when patient, as you said, will never have any symptoms, but suddenly one fine day he'll have light discomfort or something, and when an ultrasound is done, he might be having a very huge stone stuck in the kidney or in the ureter or elsewhere. So what we would suggest is, irrespective of whether it's a part of your health checkup or not, it would be better or wise to get a yearly ultrasound done to check the status of your kidneys, check if there's any infection, any stones, any swelling associated with it.
Okay, doctor. We have Rohan Poonawala. His question is any lifestyle changes, are they going to prevent me from having kidney stones?
Yes, definitely. If a healthy diet is very important, first thing is, as I said, hydration. Then the other thing is including a lot of vegetables and fruits in our regular food, because most of us have a lot of non-vegetable or foods in our diet. It's more of junk or other food. And adequate hydration, these, if you can have proper amount of sleep, a little, I wouldn't say complete stress-free lifestyle, because that is not possible for most of us. But if you can reduce the amount of stress in our life, probably through yoga, meditation, or a normal walk in a day, then keeping time for yourself in a day. These tend to keep us mentally also stress-free. So these simple lifestyle changes can really bring about a lot of change and prevention of kidney stones.
Right. Many times people ask that, for example, I have a kidney stone or I'm going through, the treatment procedure, etc. Can I still continue doing my workouts, doing my physical workouts, my gyms, my walks, my jogs,
Yes.
etc.?
Just because there are stones in the kidney or the uretero-bladder, that is not going to hamper you from having your regular physical abilities every day. So even though the patient has been detected with small stones elsewhere, they can still go about with their daily lifestyle, their regular habits every day.
Okay. We have Vyapi with us. The question is, what are the various types of kidney stones?
Yeah, so we have different type of kidney stones. The most common thing that we see on a day-to-day basis is the calcium oxalate stones. You have calcium dihydrate stones, there are monohydrate stones, calcium phosphate stones, struvite stones, triple phosphate stones, uric acid stones, cysteine stones, drug-induced stones. Name it, I probably have to give you a list of maybe 10 or 15 different type of stones. But in India, generally the most common stones that we see are the calcium-based stones or the uric stones.
Okay. And doctor, what are the common mistakes that people do when they have kidney stones? Because when patients come to you, I'm sure there are instances when you think that, oh my God, you should have come to me before, or you should not have done this. So what are the common mistakes that people often do?
So generally the most common thing is that I have seen is, especially with the women, is they keep having recurrent attacks of UTI, for which they take it very easy, or they take an over-the-counter drugs, or they keep on having these repeated attacks. They keep having it over every 2 months, 3 months. They use multiple antibiotics, multiple things, and they don't they've not been advised, or they're not aware about the ultrasound. But after a year or a year and a half, they come back to me, and then when we do an ultrasound or a CT scan, there is already a severe swelling of the kidney with a stone stuck somewhere in the ureter. So we have seen a lot of conditions like that. That is one common thing. The other thing is, this is not generally seen in the urban community, but we've seen it coming from the rural, where they do have symptoms. They do have flank pain, they have pain, they do neglect it for multiple months or years. And then the stone grows over a lot of period of time. And when the pain is not getting control for them with the painkillers, that is when they come to us. But at that point of time, the stone is already very big, or the kidney has landed up in infections, or it's not functioning properly. These are the different instances that where we have seen in difficult situations.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yeah, so the take-home message that I would say is, the first thing is, whenever you see a kidney stone or something in your ultrasound, don't get worried. Please visit your urologist or your treating doctor. Whenever you have symptoms, as we've mentioned, please do not take it easy. If you have any of these symptoms, please do consult them. Don't take a urinary tract infection or other very easy and take over-the-counter drugs. They need to be analyzed, evaluated, and treated accordingly. And the last thing, the most important thing is to prevent formation of kidney stones, or to treat already existing small kidney stones. The best mantra that would be is, hydrate yourself, drink adequate amount of water, and that is going to solve most of your problems.
Thank you so very much, Dr. K. Samyuktha, for your valuable time. It was wonderful talking to you. It was indeed a very informative session for our viewers, for sure. Thank you so very much.
Thank you so much.
And for viewers, thank you for your excellent participation in today's session. For more information and updates, stay connected to Prostate Wellbeing. We are also available on Twitter, Instagram, etc. Thank you.